My name's Melissa Higson and I am the IPE lead here at Mid Central, and I'm also a radiation therapist. I'm the clinical educator, radiation therapist here as well. The program itself, the idea of it is for students to work collaboratively, and that's what we're seeing with these undergraduate students in that they progress into their career and they can work together. They can see how different professions work and then build that into their own practice. Well, I think what we see is those students working together. They can bring to their work what they've learnt from the different disciplines that you know within their team that they've worked with, and they can bring that into their practice. And I think that's what the staff see. They can see the students working collaboratively, and we can learn from the students as well during the process. Our IPE program is that the students all come together to present what they've learnt and how they've worked together, and that's the coolest part of the IPE program, I think, because I can see what the students have gained from the program and they can put it all into practice. They can share that with everybody else in the room and we can all draw on the different things that they've learnt and yeah, we can implement that into our practice as well. So,
Kia ora, I'm Natalie de Vries. I'm a paediatrician, that's my core job, but I'm also the Associate Dean for the medical students here in Palmerston North, so the Regional Associate Dean. What I do see is that it's kind of an eye-opener to them. I think one of the nice slides that we show them is how can they work together if they've never learned together, and that's what we're trying to achieve. By learning together, they will be able to work together better. If you study in silos and then suddenly on the work floor you have to work collaboratively, you have no idea what other people can contribute to the patient care. If you start learning that during your education, that will definitely have benefit, you know, once you're out in the field and actually deal with real patients. Working in pediatrics, we work on a daily basis with all kinds of other professionals like dietitians, nurses, physiotherapists, all kind of different professions, and it's really important for patient care to work together. There's a lot of knowledge and skills out there, and together we contribute to provide the best care for the patients. If you think you have to do it by yourself, that's probably not going to lead to the best care. And that's what we see here, is that they suddenly their eyes open and they understand what a dietitian does or a physiotherapist does. They know what they can expect from them, but they can even take their head on sometimes and ask the questions that would normally be asked by a physiotherapist. You don't have to wait for a physiotherapist to ask that question. You can do that as a doctor as well. And to work together means that the patient does not have to repeat themselves again and again with the same story. If we work together better and we talk to each other better, that will be of benefit for the patient. Yeah. All right, one of the slides that we show to the students at the beginning of the IPE session is how can they work together if they don't learn together, and that is what IPE is all about.
Kia ora, my name is Delamy Keel. I'm a palliative medicine specialist at Arohanui Hospice, and I've been doing the interprofessional education for the last 4 years. I think they arrive not really sure about what this is all about, and it is really clear by the end of the presentations that they totally understand what it is to be working as part of an interprofessional team, to be interacting and to be talking to a real patient with real problems on a real patient journey. We have students come to the hospice for short-term placements at the end of their training, and so I'm more aware of pointing out that the work that we do is interdisciplinary and pointing out the members of the team, and they get to sit in on 2 interdisciplinary teams and see the team in action. The presentations are so heartwarming. It is so wonderful to see the students using the Te Whare Tapawha model, and for them it's like, gosh, this really works. I teach them at the first session to just let the patient talk and it will all be okay, and on the presentation day is more than okay.
So I'm a student dietitian from Massey University.
I'm a third year nursing student from Massey.
I'm a final year medical student from Otago. We met with a patient who's currently undergoing radiation treatment. So maybe you've got it better.
his name was David. He had tongue cancer, so we were asking him how he's found his time with the going through all the systems and dealing with a lot of health professionals. How that had been for him.
I guess we wanted to just see his journey through the healthcare system through his eyes, and seeing what sort of MDT involvement there was. So having all three of us coming from different professions, I think was really valuable. For me anyway, with any IP experience, it's being able to share, your profession and your knowledge, and being able to educate other professionals, and then vice versa, learning from them and seeing, what they've learned from their experiences and their professions, and being able to take that on board, and then we can carry that into our future practice.
I really enjoyed the actual patient interview. It was really nice to have like half an hour to an hour set aside specifically for talking with him, so he could really open up and learn a lot about him. It was good having all three of us there, like professional, different ways people asked him questions and sort of different angles of his life.
I guess one of the big learning points from IPE for me is I've done it for many years, and this is probably the final year I'll get to do it as a student, so it's nice to keep building on the knowledge I've learned from my second year as a medical student till now. Learning different professions each time I'm with different students, so it's really nice to see how we can collaborate together and learn from each other. I guess the important thing, and something that IPE teaches us, that we can't do everything. We have to be able to delegate and realise they actually have a lot more strengths than we do. Like nursing cares couldn't do it even if you paid me $1 million to do it. Dietitians, we just don't have the time to talk with someone about their nutrition and things like we'd like to, but we don't have that time. So to be able to send a patient to someone who is able to do that and able to give them the time and energy that the patient deserves is like truly important. So being able to be like, yes, I can go and visit a patient, I can diagnose them, but then what? I can't do the rest. I need people to help me.
I think it's a really privileged position to be a nurse because you're the one with the patient the most. They tell you little things that you can pick up on. So I think having these conversations with other professionals such as doctors and being like, hey, I've been talking with them, this is what they've told me, just another way of getting what the patient wants across. It's been good seeing what these guys can do. It's nice to see that how patient-centred everyone is. So it's been really encouraging this session. Like we're all on the same page here, all working together for the same outcome.
When people hear dietitians, they hear diet. They just think of food, and maybe people think food's like, not super important, or they don't really understand how food can be such an important part of someone's treatment or recovery process, and especially with people with head and neck cancers, it's really important to have dietitian input because weight loss is a huge factor. But yeah, we provide patient-centered care. But we also bring our expertise in understanding how these treatments affect us in our body.
I think this IP experience has been really interesting, and I think we've all gotten lots out of it. I think it's been really useful to get to talk to a cancer patient and who's gone through such a long journey with healthcare, and especially talking with other health professions as part of that. I think we've learned a lot from their journey, and I think we'll get some big takeaways from that. Because of their openness. Patients who have cancer have engaged with a lot of different health professionals over their cancer journey, and they, I think because of that, they have some really important insights into great things about how the healthcare system works, and then some challenges, especially when there's not clear communication between the healthcare team. And I think programs like IPE aim to reduce those barriers in the future. So hopefully we've gained from that, gained from our interviews with those patients.
Psychology is social workers are often extremely helpful. So oncology, radio oncology.
And I think like general practices, point for first contact and follow up, and potentially, I don't know, it depends on the type of cancer. You might have like gastroenterology input, things like that. Head and neck cancer, speech language therapist input.
Depending on the age, it could be pediatrics or general medicine as well.
Depending on where the cancer is as well, physiotherapists can be really helpful also.
I think previous IPE, we didn't interview patients as a group. I think it was more written like case scenarios, how each discipline plays a different role and what that specific discipline would offer. But in this case, it's more of a in real life example. What is each specialty interested in? So then we got to see how things play out in real life.
In our last year of medicine now, and a lot of the professions that we're working with are also in their final years, as opposed to previous times when we've been a bit younger, we actually have a stronger grasp of what we do in our roles as health professionals, and it's kind of more realistic and kind of applying what we do know and how we actually would manage the patient in a few months' time.
IP teaching also does reinforce a lot of things from previous teaching as well, such as like communication and the importance of teamwork and efficient collaboration. So definitely a lot of new things to take from it, but it does reinforce things that we do go over previously as well.
I guess there's like always an inherent hierarchy within the hospital, but having sessions like IPE kind of reinforces the value of having multiple disciplines inputting, and how, as single healthcare professionals, we're not going to cover every base and we're not expected to. That's why we work in a team together, and kind of having that freedom of communication to actually want input from other people instead of, sticking to a really rigid hierarchy is pretty useful.
In healthcare, it's a team effort. You need a lot of people looking after one person in order to get a really good understanding of their situation. And that can translate to managing a patient in ED, for example. The doctor will see them for maybe 20 minutes at max, but the rest of the time it's going to be the nurses looking after them. So they have a very good understanding of what's going on, and it's about respect, and that's something that this helps to develop and contributes to not becoming that doctor.